Ebola epidemic isn't quickly brought under control, economies in the region will be devastated. The World Bank says West Africa could lose more than $32 billion by the end of next year. Let's bring in CNN's Jim Bolden to help us break down the numbers. Jim joins us from our London bureau. Jim, it's a staggering number. Where are they getting that from?
Well, what the World Bank is doing is they're looking at the economic impact now with more than 3,000 people dead, and they're saying, what would be the impact if it spreads? In other words, the other countries around the Sierra Leone, Liberia, and Guinea were to also have infection, and that would really shut down the growth engine of Western Africa. So they're saying, for instance, in Liberia could lose between 6 and 12% of its GDP by 2015 if this is not contained. And what they're trying to say, of course, is that these countries need help from the West. And I think that's the important part of this from the World Bank. This is an update to their to a report they put out a few months ago about Ebola. Now they're saying, of course, because it hasn't been contained, they're very, very worried. What they are pointing out, though, Maggie, is that Nigeria and Senegal have seen limited impact from Ebola because they have a working, I should say, healthcare system. And what the World Bank is saying to the Western nations, we need donations, we need money, we need help to make sure that all the countries in that region have viable healthcare systems that people can trust, and that should help keep the contagion from spreading. But if it doesn't, they're looking at devastating impact for all that Western African region, Maggie.
And Jim, there's no doubt that the human toll is staggering, and we've seen for ourselves with our great reporting coming out of the region how devastating this is. There are going to be some who look at this number, although well-intentioned in terms of beating the drum for fundraising and saying it's staggering, but those numbers would indicate that this is never going to go away. We've seen many times with natural disasters that these are sort of short-term impacts, and that if you can get in front of it, that you will then see a rebound. Is there any reason to believe that this is any different?
I think that's why they're pointing out that Nigeria and Senegal have been able to contain it, because there is so those are hard examples of what we can do in other countries to try to keep it from spreading. And I think that's what the World Bank is trying to say. Now, we know when we have disasters and countries pledge money, almost always that money is never the amount that countries say they will pledge. And I think that's why the World Bank is trying to get out in front of this, because they're saying we need this, we need this. Look, we know West Africa is a growing part of the world economy. We know that this will impact. I know this is about people, but when we talk about the economies, this will impact other countries. This will impact travel, tourism, this inward investment, outward investment, commodities. There are so many places that this will impact the other countries of the world. That's what the World Bank is trying to make clear. There is the human tragedy, absolutely, but they're trying to show a way to stop it from spreading.
Absolutely. And again, this brings us back to the importance of investing in infrastructure before you get to the point where you are dealing and grappling with a disaster and trying to catch up. And Jim, from the first case of Ebola to where we are now, when you're tracking it, those dollar signs have been getting exponentially bigger as long as the world community has been a step behind this. It gets more expensive if you're not ahead of it, doesn't it?
Yeah, and what we're seeing, of course, we are seeing Western nations who are trying to bring in healthcare workers. They're trying to bring in hospitals. They're trying to build these temporary infrastructures to try to help the people on the ground. We've seen countries donating doctors. We've seen NGOs, of course, going in. But what the World Bank is now saying is what they're calling the worst-case scenario for 2015. And what they're saying is that more needs to be done now to keep it from spreading. And they're trying to give very hard examples of how to do it.